Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we'll go back into chapter number 6. So remember, we're in the book, The Specialty Practice for Rehabilitation Nursing, a Core Curriculum, the 8th edition. And on page 94, we're under the header, Quality and Safety Frameworks. So on page number 94, we are under the Quality and Safety Framework. So the book mentions about several frameworks that have been used to classify and organize the quality of care concepts. It doesn't list all 7. It does list, though, one important one, which is Don Bedian's. And Don Bedian, as you've been taught in the past, is the father of quality improvement. And his particular framework classifies quality measures as structured measures. And it's looking to track whether a particular mechanism or system is in place. It also looks at process measures which track performance of a particular action or an outcome measure, which considers the end result and the end results of care, such as morbidity and mortality from a disease process. So Don Bedian is being highlighted in the book, and his framework is still being utilized today, even by the CDC. A second framework that's used to classify the quality of care is coming from a report, and the report was called Crossing the Quality Chasm, and that was put out by the IOM. IOM is the Institute of Medicine in 2001, and it refers to the 6 aims of healthcare delivery, and is known by the acronym STEEEP, and the acronym is STEEEP, and it stands for safe, 1, that's the S, T for timely, that's the T, E for efficient, first E, second E is effective, and the third E is equitable. Lastly, it's always going to be patient-centered. And this model emphasizes the following. 1, it's safe care does not injure the client, so there's no harm in this. It is intended to help. It's going to be timely, there's no delay, so timely care is provided in a way that reduces wait times. There's going to be effective care, which involves services that are based on scientific knowledge. Scientific knowledge is systematic, it's organized, it's a body of knowledge about the natural world. But there's going to be some observation, there may be some experimentation, as well as an analysis of the scientific method, right? Then we see efficient care. It's always going to avoid waste, including waste of equipment, supplies, ideas, as well as energy. It's always going to be equitable. Equitable care does not vary in quality. So because you live in Tanzania, we are not going to give you equitable care. No, the care that you're receiving in New York or the care that you're receiving in Tanzania should be the same across the board. It's also not going to be affected by one's gender. It's not going to be affected by one's ethnicity, or again, like the geographic location or socioeconomic status. If you're poor or if you're affluent, you're still going to be able to get the same care across the board. And lastly, it's patient-centered care, which is going to be respectful and of course is going to be responsive to the client's preferences, needs, and values. So it's going to be tailored. It's not one size fits all. It's going to be tailored for that specific patient. So on page number 95, it says in 2017, CMS transitioned to a new framework called Meaningful Measures. And under the Meaningful Measures initiative, the focus is on the highest priorities for quality measurement and improvement. So if you turn to page number 96, on figure 6-1, you'll see the Meaningful Measures picture. And at the center, it's saying, or CMS is really saying, we want to improve our customer experience at the core of what we're trying to do. We also want to support state flexibility and local leadership. We also want to support innovative approaches, and we also want to empower our patients and our doctors. So if we can empower our patients and our doctors, if we can support innovative approaches, if we can support our states being flexible, what one state may do, the other state may not want to do. But we are going to say, hey, we're not shackling you to our one size fits all. We're giving you the flexibility to roll this out how you will, or how you feel is appropriate for your particular state. This is going to improve the overall care of the patients and also enhance the ability for our physicians or our medical providers to ensure that patients are getting the highest quality of care. So they're doing this by one, promoting effective communication and coordination of care; two, promoting effective prevention and treatment of chronic disease; three, working with communities to promote best practices for healthy living. So we'll see the Healthy People series continue. We'll see making care affordable, right? Four. And for five, we're going to make care safer by reducing harm caused in the delivery of care. And lastly, we're going to strengthen person and family engagement as partners in their care. This is a good time to segue into our discussion of stakeholders. So a stakeholder is, it says, a person, group, or organization with a vested interest or stake in the decision making and activities of a business, organization, or project. So we can consider CMS as an external stakeholder because they are a payer. But what is an internal stakeholder? It says on page number 95, internal stakeholders can include a program's board of directors, case managers, administrators, and clinicians. And the importance of having the stakeholders is really to ensure that we are looking at the whole operation from soup to nuts and ensuring that patients, nothing is being missed. There's every base is covered. So at the stakeholders meeting, there is a sharing of performance data with internal and external stakeholders, and this has really become a standard of practice. So in summary, we looked at Don Bedian's framework for quality measures. We also looked at the STEEEP acronym for the delivery of safe healthcare. We also looked at the CMS measure meaningful measures. We also took a look at external and internal stakeholders and how they keep us not only accountable, transparent, and how they help to ensure that safety and quality are both maintained. I want to thank you for coming along on the CRRN journey, and I want to encourage you to comment, like, and subscribe. Thank you all, and have a wonderful day. Take care. Bye-bye.